Hello, everyone. Good afternoon. Thank you for joining today's QTECH meeting. We'll get started in just a couple more minutes. Hello, good afternoon. Thank you for joining today's QTECH meeting. We'll get started in just a couple minutes.
Good afternoon, everyone. We are just going to take a few more moments and we will get started shortly. Thank you. All right. Good afternoon, everyone. I first and foremost want to take a moment and say thank you to each and every one of you. I know there is a lot going on in our world right now, and we could not be more grateful and more proud to be standing by you all as you are working in our communities to help our patients. So we are trying to be very mindful of your time today, knowing that you all are juggling so much. And so with that, we're going to kick off our meeting. We promise not to hold you longer than needed. So as this dialogue and information comes through, just again, trying to be mindful. So going to the list of agenda items and objectives for today, we are going to go over, hopefully many of you had a chance to join us last week during our webinar that we held in conjunction with the Alliance Chicago. Thank you very much to our health centers who participated and shared insights into what they were tackling. We have some information to share with you. We did ask for feedback from our centers. Each CN is trying to continually keep a pulse on your needs, understanding those may change on a day-to-day basis, but looking at how we can further support you. So as we go through the discussion through that, we will highlight what we heard from you all during that webinar, where to direct you for some resources. We know you all are getting an influx of communication across the board from various different organizations and throughout the industry. Wanted to start the conversation, as you all are really diving into the immediate need in handling or managing the coronavirus and the populations affected by that, but also keeping in thought how do we continue operations and what are some of the tactics you all are thinking about as you look forward, and starting some dialogue around that. Many of you, one of the key feedback we received from you all was regarding telehealth strategies. So we are going to spend a few minutes and much more to come next week on sharing on what we're doing at the network to support you and what are your needs and additional strategies so that you all can plan accordingly. And understanding that it is an urgent and critical need for your health centers today. And then thank you ahead of time to Dr. Saul at Providence Community Health Centers and Allison Madden, at Community Health of South Florida to share some other tactics they're taking to help with communication internally at their health centers. Not only are we facing the challenges of dealing with our population, but we also have organizations and have to look after our team members, and communication is key in all of that. So thank you both taking the time to start that conversation with everything you all have going on. And then we will open up for discussion and wrap up. With that, I'm going to pass it along. Stephanie, if you could take it from there. Thank you.
Thank you, Meredith, and good afternoon, everyone. Thank you for joining today's QTECH meeting. We really appreciate you taking the time to attend this meeting, as well as the folks who attended the webinar we held last week, which was in conjunction with the Alliance Chicago. We had great turnout amongst a bunch of different organizations, and with that, we collected some insights that we just wanted to review with everyone. So a majority of the different support activities, we had asked our attendees to provide insights into how HCN Alliance Chicago can provide support to your health centers during the COVID epidemic. So what you see here is a listing of those different topic areas. And one of the top ones that stood out the most was virtual care. So as Meredith had mentioned, we do want to spend some time today just diving into some of those telehealth strategies and how your health center can start to implement those in preparation for future visits at the health center. On this screen, it's just diving in a little bit more into the virtual care component. So a lot of our attendees wanted more information on how to integrate virtual care as part of their services today at the health center, and how they can do so either using telephone or using video, as well as finding ways for even other staff such as behavioral health, not just primary care, but behavioral health as well, having a role in providing those virtual care services at the health center. So on this slide, we're just covering the top 5 topics that came up, recurring themes that we found in the feedback from the surveys, because we did have a Microsoft Forms that was provided during that webinar, and we also had a QTECH survey that got included as well after the presentation. So with those 2 items, these are the top 5 areas of needs that we've identified in your feedback. So thank you for providing this insight. One of the items that we've developed here at Health Choice Network is a resource library that can be accessed from our website, which we have a couple different slides that have been shown. This one is one of those slides where it shows where you can click and access that resource library. And essentially it houses everything you can imagine. So whether it's CDC resources, HRSA resources, even some telehealth, all the realms that are being touched today for COVID-19 response, you can find information directly in that resource library. So just take an opportunity when you can just to take a look and see what's out there today. Okay, I'm going to pass it over to Harut, who's going to help to provide another area where everyone gave us insight, was having forums for health centers to come together and speak to one another and kind of learn from each other and what they've had along the way as they respond to COVID-19. So I'm going to pass it on to Harut to help with that discussion.
Good afternoon, everyone, and thank you for jumping in on this call. I know there's a lot happening in the centers, and it's a very busy time, but we just wanted to provide this forum and see if we can provide some information that can help you. And to all of you who are out there on the front lines, really my appreciation to all of you. I know how hard this is. You guys are the ones who are right in the line of fire, so to speak. So we all do appreciate the work that you do. So just basically what we wanted to do, we heard you loud and clear. You like hearing from each other, and we learned so much from each other, different tactics, different things that other centers are doing. So this is basically going to be an open discussion. This is not me telling you anything, but we just wanted to have an open discussion about how you guys are handling your current patient visits, how you're handling appointments, and what's happening with your patient volume, what's happening with your visit types. Are there differences? Are you segregating your patients? Things like that. So I really wanted to open up the forum to you, and I just want you to just use this time to speak to each other. Let's learn from each other. So who's going to go first? Don't be all shy.
And we will be unmuting the lines. So if you do not plan on speaking, just make sure to self-mute, but we will be going through the list of attendees and unmuting lines as well.
So has anybody, redirected any appointments just to kind of get this discussion going?
There's Dr. Gates from Promise Community Health Centers. We have changed our triage criteria. If someone's coming in sounding like they have ILI, we do not actually want them to come in. If they sound like they have fever and shortness of breath, that's the moment we're considering sending them to the ER. The first week, we had pushed back some of our routine follow-up appointments out of concern for spreading infection. And as of this week, we've developed an internal report off of who has and hasn't been seen in the last 60 days and whether they're considered high risk by a variety of criteria. I'm providing that list to our care teams, and we've developed an outreach form in Entergy that allows us to have patients drop off that list each day, so that each day when people pick up a new list, everybody on there is fresh and waiting for a call for a follow-up visit. We're not sure how to do well visits for peds yet, but the other kinds of visits don't seem to be too bad.
Okay. Anybody else want to share what you're doing? We're hearing a lot about like patient volume dropping off. Are you all experiencing that?
Like, Can you hear me? Hello?
Yes, we can.
Okay.
Yes, you can.
I wasn't sure if I was unmuted or not. This is Julie Montgomery. I'm with Community Health Centers. So basically our patient volume, we're at like a 47% no-show rate. So we're trying to deploy our telehealth. It's not in place yet, but that's what we've been working on all week. And of course, our appointment scheduling, if it's like annual wellness visits or if it's just regular visits, we're trying to push those out. But as far as whoever still shows up, we're still taking them. But that's pretty much all we're doing.
Anybody else want to share what's going on with your patient volume?
Good afternoon. I am Sandra Roca from Burlington Medical Centers.
Good afternoon.
Can you hear me? Hello. Thank
yes,
you.
We can hear you.
Okay. Yes, of course, we have, going down of our volume, but at this moment we did a segmentation for our patients list already scheduled within the 30 days. In the next 30 days, we segment our patients for the chronic conditions with appointments, and if those chronic conditions are controlled or uncontrolled, in order to verify if this patient has already appointments and they agree to have a telehealth appointment. We have our providers doing telehealth visits. So, and we are calling all these patients to our nurses, and school nurses are helping us. We are training them to help to us to schedule those patients for telehealth visits. And of course, prior to this, we need to review their charts, be sure if the patient has complete refills for them, they have their medication refills in place in order to coordinate with the pharmacy, send the refills by courier, by UPS, and also schedule this patient in the telehealth visit panels. If the of course, we have a script for these calls to do like a quick survey to see if any patient has, of course, respiratory symptoms or needs to be in a maybe treatment condition, and just be on contact with our patients. And this is the prior segmentation we are doing to try to just minimize the risk and just let the patient know we are doing that for their safety. So we are, since this week, doing dose training, doing this patient segmentation, and starting doing those calls. And our providers are already doing telehealth visits.
Okay, excellent. Thank you for sharing.
Hello,
Okay.
this is Mitch from Community Health Center Pinellas. Can you hear me?
Yes, we can hear you. Go ahead.
Hey, yeah, this is Mitch Harrison from Community Health Centers of Pinellas. We are, as everyone else, we're seeing a reduced number of patients, but we've also are starting to use telehealth as well as phone communication with our patients. So we're trying to get more and more providers on with the telehealth. We've already got some going. We also as well have established patients drive up to get checked. They'll schedule an appointment and then drive up. And we're also have just started new patients because we're getting a lot of calls from individuals out there wanting to be able to be tested. So we're actually in the process of doing new patient pull up where we will register the patient and then the provider will speak to them via telehealth and then see if they need to be tested or not. So the things here at Community Health Centers Pinellas are moving as everywhere else pretty rapidly and quickly. So we're doing a lot of telehealth and communication, phone calling with our patients.
Okay, great. Go ahead. Somebody was trying to speak.
We do have some comments as well in the chat that I've noted. So Maggie Padron from Premier has stated that they changed their templates to include well visits in the AM and sick visits in the PM.
Okay.
This is Mitch again. Also, one of the things we're doing too is we actually have moved some of our patients, kind of rerouted the well patients to one center, as well as our sick patients to another center. So we've kind of divided our patients out to where the sick go to certain centers and the well patients go to other centers. That's one way of moving the patients around and being able to see the patients in a different route.
Yes, that's one of the things that we've kind of been hearing as we are keeping our nose to the ground with anything COVID. Is any other center doing that, like using their different sites for different kinds of visits, or their well visits and their sick visits?
Hi, this is Andrea Brandis, a quality nurse at Treasure Coast Community Health. We have designated one of our centers for our pretty much sick visits, and we have someone standing at the door. We give them a mask, and then we ask them to go sit back in their car until we're ready for them to come into the room, and we're routing them through one of our back doors into the exam room. And we had our IT department set up extensions to a certain phone, and we'll speak with them through the phone, go over all the questionnaires, and then we just gown up, go do quick vitals test, and then our doctors speak with them through the extension line as well, and then they do their physical exam, so we're minimal contact in the rooms. Also, we have all the sick visits being phone triaged by nurses, and if they can stay home and quarantine, we're calling them for 14 days, and if symptoms worsen, then we'll have them go to the one center, and we're trying to keep our wells, our well or chronic visits to another center.
All right, thank you for sharing. Anybody else want to share?
No, so good afternoon. This is Diego Schmulz.
Good afternoon. Hi, Diego.
How are you here? Basically, we're not diverting them per se, but the way we're scheduling patients, as Sandra explained, we're making sure that certain patients, depending on their comorbidities and depending on the initial telehealth call, if we spoke to the patient and the provider has the desire to see the patient, what we will do is schedule them in a way or in a manner that it is limited for the patient so that they can walk into the clinic. They should have minimal wait time. And then the patient will go into an isolated private room. We expect that the provider has done the call and the assessment of the patient before the patient walking into the clinic. So then the patient will have another phone call to finish the assessment over the phone. And then if the provider decides and makes the decision to examine the patient, he will be able to walk into the room of the patient with surgical mask, proper attire, and examine the patient. Orders should be ready in the lab, and the patient should be able to get labs drawn and then leave immediately to avoid and minimize the exposure.
Okay. All right. Thank you for sharing that, Diego. Anybody else who wants to share, or if anybody has questions for somebody who's already spoken?
This is Ashley Desmores from Beringen.
Yes.
One of the things that we are also doing, I know Diego and Sandra touched up on how we're getting the patients in, but in terms of screening, any patient on the schedule is called and is screened over the phone to see if they have any symptoms. If they do, their appointment is canceled, and a Athena text is sent to the provider and a nurse so that patient can be contacted and triaged over the phone. If it's a child, whoever is bringing the child in is also screened, and the family can no longer come to the center. It's the parent or the adult that's bringing the child to the visit, and that child only. We are trying to sort of isolate testing at one of our locations, but we are testing at our different locations, and we do have test kits at all of our locations. And that's pretty much what we're doing. We also have a nurse at each of our sites at the door with the appointments for the day to make sure everyone coming in has an appointment and is also screened again.
Okay, interesting. That's so you're calling everybody that's on the schedule prior to them coming in.
Regardless of if they're coming in for a wellness visit, regardless if they're coming in for lab results, every single person that's on the schedule is screened.
Okay, great. Right, anybody else have any comments, anything that they want to share? All right, so I think, yes.
So obviously you've been talking about the usual patients and the usual visits. And I know that some of the individuals that are joining us also participate in the test and treat. So we manage the same, in a similar way, the test and treat patients. So patients, before they are sent to our clinic, they're screened for questions for COVID. They fill out everything before arriving to the center. The center gets all the information in the package securely sent to us. And then the patient has a call with the provider, has a full detailed assessment over the phone. And then the patient will be sent again. Like I said, it goes to an isolated room, and then the patient waits for the complete finalized assessment. They get the medication, they get the labs done, and they leave.
Okay. All right. Anybody else want to share anything on how you're handling current patient visits? Okay, so we're going to move on to kind of the next thing that we're thinking about. So I know we've heard that, volumes have decreased, and, some patients may have elected just not to come. Some may have tried to reschedule. So in terms of, kind of looking forward, what kind of patient outreach are you doing? What kind of communication are you sending, messages, portal, text, telephone. Some of you mentioned calling patients. Are you doing those types of things? So just kind of share what you're doing in terms of really making sure that looking forward that we are trying to get back our patients. And I know some of you have touched on it, but I just wanted to open this up for anybody else who might want to share on this end of it.
I mean, at Borinquen, we are doing call campaigns to all patients so that we have been providing messages, educating them about our telehealth services. We've been sending out telehealth. We've been sending messages. That includes also text messaging, emails, secure patient portal, phone calls. That include asking them to reschedule their appointments if they feel that they have flu-like symptoms or they've been coughing or whatnot. So those have been the basic messages that we have been sending out to them so that we can avoid them from coming to the clinic. And then as of this week, we started posting different messages, educating them about the patient portal, about telehealth on social media, Facebook, Instagram, Twitter, that sort of thing.
Okay. Great. Anybody else want to share what you're doing as far as patient outreach, trying to get patients back in? Okay. Okay, we don't want to belabor the point. I mean, if this is, just things to think about. I know you've heard a lot on the previous discussion. People touched on this. So I'm now going to turn it over. I mean, we're hearing a lot about virtual visits and telehealth visits, and you guys had a lot of questions about that. So I'm going to turn it over to Sue now, who's going to kind of walk you through some of what we have as far as telehealth strategies. Sue?
Hi, everyone. Excuse me. So my name is Sue Theatrical, and I'm going to talk a little bit about just telehealth and just point you to some resources. But first, we are going to do a poll. Stephanie, you're going to cue this poll that you're going to see on your screen.
Yes.
Is to find out what communication tools your health center has activated in response to COVID-19. Oh, there it is.
Yep.
So are you perfect? So are you using Zoom or Microsoft Teams or WhatsApp, DoxyMe, or any other communication tools?
Okay. We'll give everyone just a couple more seconds to vote. We see the votes coming in. Okay, so we're going to go ahead and close the poll so that we can see the results. And a majority of folks on the line shared that they're using other tools as well. So that seemed to be the top response, and then following that is Zoom.
Okay, wonderful. Perhaps other could be telephone, or it could be, some other communication tool. But we wanted to start off with this poll because, go ahead.
And to, of those, if we could do a poll after, I would love to learn of the other, how many are not using anything. So if we could segment that out, if you all wouldn't mind, for those that you answered an other, if it's actually none, to indicate that in the chat box.
That's a great idea. Thanks, Meredith. So we wanted to start off with just identifying what tools you're using, because as part of launching or standing up telehealth in your practice, I mean, establishing or obtaining a tool to communicate with your patients is one of the steps. Stephanie, are you there? Can the other panelists
Yes, we are
Hi,
going
Sue,
to
can
get
you
the
hear me?
screen.
Yeah.
Yeah, I can hear you.
Okay, what I'm trying to figure out is if we can the audience see the slides?
No, I can't see anything.
I can't see the slide.
Negative.
No,
Do you want me to present?
we cannot see nothing.
Okay, hold on one second.
Okay, give me a second. I'm going to try to pull back up.
So Sue, if you could just go ahead,
Sure.
Speaking to your points, and we will bring the presentation back up. Sorry, folks.
Sure. So once you have the tool, then a lot of the feedback that was shared during her root segment, I was very beneficial because that all spoke about operationalizing telehealth. And in the slide that I wanted to show you, kind of highlighted some of the areas in which you've already implemented, during this time. Designating certain locations. Oh, there's my slide. So it talked about establishing, certain visit types for telehealth or for phone, using patient portal or patient messaging to communicate to your patients. I think Berinken had spoke about that. And then just how you went about with your patient care, seeing your patients. So here is just a quick sheet that we had worked with our RCM, had collaborated with Energy. So though what you're seeing here is a general best practice that could be applied to many different EHR systems. Actually, this is, Steph, I don't think this is a handout, but if you are interested in this particular handout, I will show you in the next slide where you could find this document. Oh, but don't go there yet. So some of the questions in which we've received had to do with coding. So I know that you've received multiple resources that is coming from CMS, and we have a collection of all that in our resource library, which is the next slide. But just here, this is just at a glance, some of the key codes and when to use them that applies to FQHC billing. And it differentiates between a virtual visit versus a telemedicine visit. I know internally here at HCN, we've been having a discussion with telehealth, telemedicine, virtual visits, e-visits, but they all basically do mean the same thing. I think what we're focusing on is telephone versus telehealth video. So I think we've come to a consensus that that's how we're describing, these types of visits. So what you see here, the colors in blue is what happens in the front office as well as what happens in the back office, and what's in green is what happens clinically. So I appreciate everyone who had spoken earlier who shared their ideas. I think it's great. And I'm sure we'll probably put together just ideas that were shared, so that way if you didn't catch everything that was mentioned, that we'll have a transcription of all of that was discussed. So now, Stephanie, let's go to the next slide, because this is where I wanted to show you a resource library that we've put together, and you can get to it from the HCN homepage. So the address is here, www.hcnetwork.org, and there's a button that you can click on right off of the homepage, and it's part of our banner. It takes you to our COVID-19 resource library, and we have many folders in there that talks about different things, but what I wanted to highlight here is the resources that we've collected for you to access for telehealth. So the document, or in the previous slide that I showed you, if you want to look at that more closely, then you could find it. It's labeled HCN COVID-10 Telehealth Best Practices. So it's right underneath the folder for state Medicaid resources. So there's a bunch of good things in there too that you have access to. So now the next resource that I do want to share that's system agnostic, this was shared by High Tech, and this resource is from Center for Care Innovations, and they provide sample workflows and guidance for clinics who would transition from an in-person visit and would offer telehealth or telephone visits. But what's great about this site is that it does offer just sample workflows and guidance for those centers who are on NextGen, Epic, or eClinical work. So if you don't have, so if you need sample resources or just templates and things, this is a great resource, and it does provide you with instructions. And there's the web address if you need to have access to it.
And we've actually pulled them down as well from the website, so that's also in the same telehealth folder.
Wonderful. So those are just some resources that we wanted to share with you. I know that right now, I'm sure you're overwhelmed with just receiving a lot of information. Please feel free to reach out to us, and we'll be more than happy to kind of share with you the most latest information that we receive, or direct you to resources that we found most beneficial. I think, coming together here as a group, as a community, I think has been really beneficial. And I hope you find that it's comforting as we are all going through this together. Thank you. Let me know if you have any other questions. You could enter in the chat here.
And thank you, Sue. Just want to do a quick plug. We are having our HCQI as a follow-up to our session next Wednesday, focused on telehealth. And so this will be facilitated by Dr. Tim Long. Please encourage you all to share this with your colleagues, and really want to hear what you're doing. Share some of those experiences. And at the network here at HCN, we have a lot more information. We sent some information out earlier this week on telehealth, and we'll be continuing that communication. We're trying to be mindful not to overwhelm you all with too much, understanding that it is coming through from multiple channels, but making sure that our information is targeted. So lots more to come, and please continue to share with us your needs as we can adapt and help support you quickly.
Right, fantastic. So now we're going to pass it on to two representatives we have on the line from our health centers who are going to speak to us today about some workforce communication tactics during the COVID-19 response. So I'm going to go ahead and unmute Dr. Saul. Okay. Dr. Saul, you should
Now
be
you're
unmuted.
Yeah, you take me off mute, you're going to pay the price. Can you hear me?
Yes.
We
Oh,
can hear
goody.
you.
Yes, we can hear
Awesome.
you.
Hi, Meredith. Hi, Harut. Hello, Florida. Anyhow, hi, this is Andrew Solom up at Providence Community Health Center. We are conveniently close to New York City, which is having a really, really miserable week. And we do have a lot of people who drive in and out of there. So dear little Rhode Island has been one of the epicenters here on the East Coast. So we've been burned, but as you heard from Dr. Gates, we're coping well so far. Harut asked me to talk about some of the fun things we're doing here. I'm going to cover this in about 3 minutes, maybe more. I'm saving the best for last, so please bear with me. And a lot of this may seem basic, but that's the point of this, is that we employ human beings in our practices. So needless to say, communication is everything. And when the feces hit the fan, we went big on Latino radio, press, media, web, text, Facebook, all these things we got out there in the community with our representatives. But we also turned around and went to the staff because we recognize that these are real people, and fear and secondary trauma and stress are very, very real in health centers, and you have to acknowledge that. So one of the first things we did is I've been sending out a newsletter, and it's broadcast to 2 different audiences. How do you handle a newsletter if you have no time? You make a Word document and you just keep upgrading it. Every day or every other day, I go in there and change a few numbers. The target audience for the all staff one, that one includes, the whole reason for that is communication, dispelling fear, and improving morale. The other version of this, kind of the same document but modified a little bit, is targeting clinicians. And by that I mean nurses, medical assistants, and the health center directors. That one has more technical information on it. But remember, the attention span of people is 1 at most 2 pages. And you've got to come big in the opening lines to get their attention and hold it. So of course, we've been using a Word document, and I swap in and out the updates and the bullet points. More importantly, we've discovered is, given the rapid transformation going on in healthcare, we started talking about best practices and success stories, and just a little bit of humor, not too much. You've got to be respectful of what's going on, but a little humor can certainly break the ice on this. When we have this document up and running, of course, we email it in a PDF form, but we also post it on our SharePoint. So everybody who's logging into the system sees the CEO's message in those most critical moments right there. In the background, on a day-to-day basis, of course, we have a Skype for Business through our network. So we have our incident command meetings, senior management meetings, and the directors and managers. We're talking every day. Incident command meets from 8 to 9. SMT has a brief meeting every day at 10, and then we report out what we're up to the health center directors and managers at noon. But around day 3, we realized something really important was missing from all this, and that, of course, was the physicians, practitioners, and PAs. And so we started doing something about, I think it was on a Sunday night. So Friday the 13th is when the poop hit the fan. We all started talking more on Saturday, and Sunday night we launched Radio Free Providence. And we use our Skype platform, though you could do this with Zoom as well. Every night at 8 p.m., we actually have all the docs call in. And we've been taking turns hosting this. And if you're not hearing dogs barking and beer and wine sounds, you're not doing it right. The whole point of this is for people to let their hair down and be human beings. The first couple of these, it was all technical and updates. But these things really, really began to evolve. And now we're talking about stress points in the system, what works and doesn't work in terms of getting people in and getting people out. Because it was kind of a very informal dialogue, a lot of us who knew this and a lot of other people who didn't heard from OBGYNs, pediatricians, and people who wouldn't normally dare speak up. We got some wonderful details on the ground from that. And so during this time of rapid transformation, we began focusing on best practices. So now when we get going in the evening, there's usually a couple minutes about what works and doesn't work. And I've been amazed. I don't have to ask anyone to speak. They chime in. But the most fundamental important reason why you want to do something like a daily call-in is to recognize that human beings are practicing medicine. And there is a lot of counseling and stress and grief going on. I just emailed Harut the article that we use a lot. This dropped in Harvard Business Review this past week, and it talks about anticipatory grief. When there is a hurricane, when there's a tornado, you have the immediate crisis, and then hooray, you can rush in and start rebuilding things, and recovery begins almost as soon as the disaster ends. What's different about the pandemic is that it's open-ended. It's a slow motion disaster. We can't get into the recovery phase. All we can do is respond. And if you didn't guess this already, physicians hate feeling powerless. That is one of the most frustrating things. Throw in a little OCD in some people and you can really see how they get stressed. And so at these meetings every night, we let people, they're very respectful, but everyone needs to grieve in their own special way. So we found ourselves, repeating some common themes, and it's a lot like the Serenity Prayer. This isn't normal. This is temporary. And if we play our cards right, things can be changed for the better. And so that is Radio Free Providence coming to you live 5 to 6 nights a week on our Skype network. And man, it's been a journey. And that's what we're up to.
Thank you, Dr. Sal.
Any questions? Did I silence the room?
They may
Dr.
be muted.
Sal, would you? Yes, I believe they are. Can we unmute the line? And
Yes,
Dr. Sal,
they
hi,
should
this is
be.
Meredith. Would you mind if we share, for those of you who may be interested, some of the templates I know we've been collecting, or making those available so folks can tailor their own, perhaps if they're interested in doing this, their own internal communication?
Yeah, do you have the Word version or the PDF? Hopefully, I can send you a Word if you don't have it. I found that every other day is probably just enough. And it takes you like 10, 15 minutes to put it together, but it's just priceless in keeping people going.
We'll follow up, but thank you so much.
It looks like we don't have any questions at this time in the chat. Lines should be unmuted unless you are self-muted to ask questions. You could just go ahead and unmute. But we do have some comments. Dr. Bendel from Orange Blossom said thank you very much for sharing that.
You're welcome. And Harut, you can forward the link I sent you with the article.
I will certainly do that. We'll send it out after the meeting.
Fantastic. So then now we're going to pass it to another health center, Community Health of South Florida. So let me just go ahead and advance the slide here for everyone. And they're going to talk a little bit about their communication tactics at their health center and what they're doing to keep everyone engaged and informed during the COVID crisis. So let me go ahead and unmute.
Hi, good afternoon, everybody. This is Allison from CHI. And basically, I'm going to talk a little bit about what our executive team and what our corporate staff team is doing to inform staff. As you know, we have 11 health centers between Dade and Monroe County. So we're pretty far stretched as far as staff communication goes. We have formulated a COVID response team, which consists of our CMO, Dr. Amofa, our Chief Nursing Officer, our COO, and our infection control nurse. And they meet on a daily basis to go over the updates and changes that is happening with this pandemic. And once they do that, basically we on our SharePoint site we have an FAQ, basically frequently asked questions, and we update it on a daily basis. And we want to let our staff know how we're keeping them informed about what we are doing as far as patient care goes, as well as keeping them healthy. Because our main asset is our staff, and we want to make sure that they feel secure and healthy during this process. In addition, our HR department has sent out talking points to corporate staff to make sure that our line staff is informed of what is going on a daily basis. We also have instituted a toll-free telephone number, which basically staff can call in to receive voice updates on different policy changes. Our extended team includes our Vice President of Communications, our medical directors, and all ancillary service directors, as well as our site clinical coordinators. We currently screen patients according to the latest CDC guidelines. We are screening patients prior to entering each site, and for those of you that know, we have began a drive-through testing facility. We were the first testing facility located in Miami-Dade County. We've screened well over 1,500 people, and we've performed about 400 tests so far. The tests have been slow to come back. We've received some, the initial tests from Quest were sent up to Virginia, to Chantilly, Virginia. We're still awaiting those results, but some of you know that recently Quest had moved some testing to the Miramar site as they received some equipment there. So we received those results on a much quicker basis. Our screening results are basically 13%, 13.5%, which is pretty consistent with Dade County. Although the state of Florida has a 9% positivity rate, Dade County is up about 15%, and we are currently at about 13.5% positive rate. We are also receiving information and screening from Jackson Hospital, as well as some first responders in the area. So that's been our main focus at our Doris Eisen location, which is located in Cutler Bay. We're only screening and testing at one site, or should I say testing at one site, and they do have to meet all protocol. We try to send emails out on a daily basis. Our COO sends out emails to staff on a daily basis. And as I said, on our SharePoint site, we do have our FAQs. And of course, our staff are open to any questions that our staff may have, as well as HR. There have been some concerns as far as staff goes, and they're allaying those fears. We also put out a survey to staff to see how many of our staff need childcare. We are thinking of providing childcare in another location to some staff, so we're kind of gaining some feedback as far as that goes, because we want to do anything within our powers that's feasible to help our staff. And that basically does it. We are looking also at rolling out telephonic communications at this juncture. We're not quite ready for a telehealth platform. We're still looking into some applications such as DoxyMe and Zoom. We want to make it as easy for the patients as possible and not burdening staff with an additional layer of issues. And that basically does it from Miami, Florida.
Thank you, Allison.
Any questions?
All right, no questions. Anybody else want to share anything unique that they're doing? Are they unmuted, Stephanie?
Yes.
Is there anything as you all are navigating through, specifically on this topic, that you're having challenges with, that more information would be helpful, or a continuation of this conversation? Is that something you all feel is worthwhile as we look to continue bringing forth topics in future meetings? So if we could get some feedback either verbally or over chat, specifically regarding kind of workforce related items, we'd love to hear your feedback. All right. Oh, was someone going to say something?
So we just have a comment in the chat now. Someone is saying that they think it would be very helpful to discuss what health centers are doing during this pandemic. So they're finding this conversation very helpful.
All right, thank you for that feedback. All right.
Okay. So some of the slides we have left on our presentation today just cover the COVID-19 resources that are out there. You may have seen a couple of them going through at the beginning of the meeting. So one of the slides we have here is actually directly from the National Association of Community Health Centers. So they have their own webpage that's dedicated to the coronavirus, and they just have a couple different highlights that they wanted to share, and it's all located on this one slide. One of the things that we've seen beneficial as well is the Noddle Pod, which is that last option that you'll see listed there. If you've had an opportunity to attend any of their past webinars, they do mention that forum as a really good place for folks just to have conversation amongst one another as well, and see any sort of important national resources that may be beneficial during this time. So this will be included in the slides for you. This is just the resource library. As we mentioned today, this can be accessed through our Health Choice Network website. So if you log in to hcnetwork.org and our webpage, you'll actually see it up at the top, but within the slide deck, you'll also have a link that will lead you to the resource library as well. As we mentioned, we will be hosting a webinar that will be occurring next week in reference to diving deeper on telehealth and hearing from one another on updates on those workflows and having further discussion on those efforts. And one of the last resources that we have here are just some dates to remember. So when you have an opportunity, just take a look at these different webinar opportunities. If you're able to attend, there's different areas such as NAC, who's having a webinar series, as well as even our partners with DentaQuest are having their own set of webinars as well in reference to COVID-19. So if you have an opportunity just to check these out, these will be in the slide deck for your reference. So I'm seeing that we do have a question within the chat. So from Douglas Steele from Care Resources asking if health centers are able to obtain swabs for testing. So I don't know if any of the folks on the line can unmute and share a little bit about that.
Yes, we are receiving testing swabs. We did have a little bit of an issue on Monday with Quest. They couldn't provide us with enough testing swabs. We also have been receiving testing and doing testing through a community hospital located in South Miami, and their testing site is in Palm Springs in Hialeah. So we are receiving a lot of testing media from that organization. And Quest is also, they have drop shipped us some supplies on Tuesday. They were sent via FedEx, and they are trying to keep up with our demand.
Great. Thank you, Allison.
You're welcome.
So I do not see any other questions at the chat at this time. Your line should be unmuted unless you are self-muted. But if there's no other questions, then I'm going to proceed to the next slide.
All right, thank you, Stephanie. We, as promised, wanted to be mindful of your time today. We want to take a moment and just thank you all very much. Keep your chins up. We greatly appreciate everything that you and your teams are doing to support our community, our communities. Please know that HCN is here to support you. So if there's anything that you think of that we can be of assistance now, any ideas that would be of value for you in this forum next month, we are going to continue to push out information. We are speaking to different levels of staff and trying to push different types of information to you all. So please know we are here for you. And we are sending our thoughts and prayers and positive thoughts for you all personally and professionally. So thank you, and everyone have a great day.